Okay, well, welcome everybody. This is the March meeting of the JAX Chamber Health Council. My name is Jason Lafser, and I am the 2021 president of the Health Council. So welcome to all of our members and all of our guests and speakers here today. It's hard to believe it's been about a year now since we went virtual. And like everybody else, you know, we made it through the year. We are certainly hopeful that we'll get back to in-person meetings maybe by the middle of the year, but with obviously being respectful of all of our frontline healthcare workers, we're taking it maybe a little bit slower than some of the others, just to be respectful of that. But you know, hopefully with the vaccines getting more widely distributed, we'll be able to get back to in-person meetings. I know I certainly miss seeing everybody in person at Deerwood, and I'm sure there's others as well. So we're looking forward to that, and just want everybody to know that we are considering that and working through that, and the hope and our goal is to eventually get back to in-person meetings soon. Just a little bit about the Health Council. We are the JAX Chamber Council that's charged with promoting health and wellness in the Jacksonville community. And so obviously the majority of our members and the majority of us here today have some affiliation or connection to healthcare or wellness within the Jacksonville community. So again, welcome to everybody. Next slide, please. Is that me or is that you, Kathy?
We're working on it. I apologize.
Gotcha. That's all right. We'll go over basically the agenda for today. We've got some announcements that I'll make specific to the Health Council. Some announcements from Tina Robbins related to chamber events and chamber announcements. And then we've got two wonderful speakers lined up today. We've got a spotlight speaker, Laura Godwin from Florida Blue is going to talk to us for a minute. And then a great keynote presentation lined up from Karen Hughes with the American Lung Association. Following the presentations, depending on how much time we've got available, we may have some time for virtual networking toward the end of the meeting. And so again, time permitting, we want to give the speakers as much time as they want. And obviously, if people have questions, that's the primary purpose of being here today. But we'll break out into breakout sessions if we have availability to do so for some networking, and then come back together at the end just for some announcements and to talk and remind everybody about our April meeting. One thing I did want to mention before I talk about some of the other announcements is that March is National Women's History Month, and coming up in a couple days on March 8th is actually International Women's Day. So I'm happy that we've got two wonderful women that are speaking to us today, and just wanted to touch on the mission of International Women's Day is to celebrate women's achievements and increase visibility while calling out inequality. And their theme of 2021 is Choose the Challenge. And it says, a challenge world is an alert world, and from challenge comes change. So let's all choose the challenge. So I'm very honored and thankful that we were able to get such great women speakers for this month, and happy that we can celebrate their achievements and accomplishments. I did see the slide for the board of directors, so I wanted to just thank all of the board of directors. These are the people that really make everything happen behind the scenes, and are the ones that help get great speakers for all of our meetings and just make sure that things run smoothly. These are also the people that, if you're interested in becoming more involved with the council, have questions about the council, these are the people to reach out to. Obviously, myself and anyone on here would be happy to have a conversation. If you're looking to get more involved, we have a variety of ways you can get involved on the committee level. And if you are interested in joining the board of directors, that's typically the process, is get involved on a committee. And then eventually you can roll onto the board of directors if that's something that you're interested in. But please reach out to any of these individuals if you are interested. Normally, when we meet in person, I ask these people to stand up and we can give them a round of applause. I haven't been able to do that, obviously, in the virtual session, but if you are on the board of directors and maybe want to wave to the camera, I still do appreciate, obviously, all of your time and efforts that everyone puts in. So I wanted to thank all of you guys. And then last but not least, I want to thank our sponsors. Florida Blue has been a sponsor of ours for several years and very instrumental in what we do in the Health Council. And not only the Health Council, there's other councils as well in the chamber. But they've been a partner of ours for several years, and we're very thankful to have them on as a sponsor for 2021 as well. And then Moran Builders also joined as a sponsor for the 2021 year. And so we're very thankful to both of these sponsors, not only for their monetary contributions, but also their time and, having people serve on the board. So we're very thankful to both of those sponsors. There are still monthly sponsorships available if you're interested in that. Again, speak to anyone on the board. But there's the opportunity, if you're interested, to sponsor us, sponsor one of our monthly meetings and have an opportunity to talk about yourself and or your company if you're interested in that. So with that, that's all I've got. I'm going to turn it over to Tina Robbins, and she's got some chamber announcements, and then we'll get going.
Thank you, Jason. Good afternoon, everyone, and thank you for attending today. First of all, if you'd like to join our chamber or become more involved with our Health Council, I would love to assist you. I'm going to post my email address on the chat area. So beginning on March 11th, we are hosting our Beaches St. Patrick's Day Networking Luncheon. Begins at noon and ends at 1:30 at the Casa Marina Hotel. Join us for this fun networking luncheon wearing your most lucky green outfit and bring all your charm. So it's St. Patrick's Day, so we're going to be celebrating that day. It's $25 with advance registration through March 10th and $30 at the door. On March 18th, we're hosting our virtual Coffee on the Coast with JAX USA Partnership Workforce Development. It begins at 8 a.m. It ends at 9. It's a virtual Zoom call, so please pre-register so you can actually receive your Zoom credentials. And lastly, on April 6th, we're hosting our Business Expo trade show at UNF. It begins at 4 p.m. and it ends at 7. $10 advance registration and $15 at the door. We'll guarantee you lots of networking, restaurant samples, and a beverage. And it's a great way to highlight our local businesses. Thank you very much. And now I'd like to introduce our own Ashley Siskowski.
Thank you. Absolutely. So glad that you guys are here. We have got a couple of amazing women that we are going to highlight today. And the first being Lauren Godwin. She's a service consultant at Florida Blue, where she guides members on how to take control of their health and wellness journeys. This includes educating them, the public, about the benefits of maximizing resources and guiding them to be self-sufficient within the health insurance space. As a Jacksonville native, which is odd, but yay, her passion for the local families and small businesses directed her to 13 years to maximize the operations and marketing within the national franchise. Then later to the Jacksonville sports facilities. This allowed her the opportunity to create nationally recognized programs and to be a leader in local niche industries. After hours, you can find Lauren at the beach, trying to keep things alive in the garden, striving to match her energy of her 4-year-old son. So Lauren, thanks so much for being here, and it's your turn.
Thanks, Ashley. And this recent weather has been trying to sabotage my gardening status. So hang in there for me. Let's pray for some sunshine. My name is Lauren. I am really just thankful to be here with all of you today on behalf of the family at Florida Blue. I know that we are responsible of this amazing health council, and hopefully you are all experiencing some tremendous success, both personally and professionally so far this year. But I wanted to take a second to really kind of just maximize the understanding on our retail centers. It is broken up into a few different components. We have our sales, our service, care, and community aspects. Now, I've recently onboarded at Florida Blue. I've joined an incredible team out in North Jacksonville. And with any new role, you have a lot to learn. You're always learning something new every day. And I have quickly realized that we are like the Swiss Army knife of the insurance space. Our retail centers act as a hub to allow us to sell plans, service members on their plans, triage their needs and care management, and try to get them connected with local resources in the community. So I really just want to kind of share why they really are a critical component to the community and such a value add to everybody here in this region. So shameless plug, there is a new open enrollment period happening right now that's been approved by our administration. It expires May 15th. So if you know anybody that could benefit from any style health insurance plan or maximize on one that they already have and expand that coverage with any kind of hospital, ancillary, et cetera, accident or critical illness, give our sales team a call. That telephone number you can reach us at is 877-352-2583. Our sales team are made up of tremendous humans. Their job is to ask questions, help better understand the situations and the needs for the individuals or the families that they're speaking with. They really want to find out, what are your health priorities? Do you need to expand on your current coverage? Do you have any coverage at all? Have you had a life-changing event? Are you getting married? Is someone having a baby? They are going to try to help you through that transition, get you settled into a plan, and are going to see you through that aspect all the way to the end. Now, one of the things I did not realize would be on my plate when I joined this organization was continuously working out. Florida Blue offers live fitness classes online, Zumba. Got to get my Zumba on, get out of the chair every afternoon. They've got Tai Chi, yoga, strength, stretching. Now, these classes really are fantastic, and we've had some great feedback from members. But rumor has it that our fearless leader at the town center, Mr. Joshua Stewart, who I believe is here with us today, loved his Zumba class so much that he ripped up his Humana card and jumped ship, and the rest is history. So if you need to ask him any questions about Zumba, he is your guy. I will direct you to him at the end of the day. But more than just some live fitness classes, we have some live educational components and webinars that have been launched as our retail centers are currently closed. They are covering amazing topics with members and non-members. Anybody in the community can log in and jump onto these just educational opportunities. I know this month, I believe we're covering topics like understanding your gut health, managing your stress, portion control, healthy diets, and even transitioning into Medicare. What does that process look like for those that are ready at that time? Now, I am a service consultant, as Ashley said, and kind of jumping into the bones of what we do. Once you are into your plan, you're established, and you start having questions like, what is this deductible? Who's paying it? What are these benefits? I don't understand. Can you help me find a doctor? We are there to help them navigate their plan, maximize their benefit opportunities, take advantage of all of the tools and resources they have. Like, hey, Mrs. Smith, did you know that you can view this claim information on our mobile app? Did you know you could log in from anywhere on our member portal and check out your bill, make a payment, check out our class schedule, et cetera? We are ultimately trying to encourage them and guide them to take control of that health journey throughout their life at Florida Blue. Now, as a service consultant, I rely tremendously on our care component. I really think it is a super underrated gem in our space. The care component, the care model that we have at the retail center incorporates registered nurses who are in-house that can talk to members about really critical topics like hypertension and diabetes, how to manage that at home. What does that look like in the pandemic? They can work on case management for members that are needing further assistance. Jumping over to our community care specialists, who are tremendous souls. They are basically connecting our members with local resources. They are social workers that are familiar with the community resources that are available, like helping them with food and transportation programs, military and veteran services. There's a huge military presence in Northeast Florida. We've done a lot of referrals over to them, covering things like medication saving opportunities that they may qualify for. The pandemic has obviously affected people financially in a lot of different ways. So access to care and medication is really important. Mental health, et cetera. They are absolutely tremendous to be able to have in our toolkit at the retail center. So listening to all of that, I can tell you when I onboarded, all I could think is like, what does this have to do with health insurance? And truthfully, if you were thinking that, you are not the only one. But I can tell you that our retail center space is truly tremendous. We've got incredible souls there that are just eager to connect and engage with members. It allows us the opportunity to listen to their needs and let them ask questions and share that feedback, share those questions so that we are constantly evolving and just improving every day. Our services are for our members, et cetera. So if there's anything you take away, we are a total health solutions in one package. We are passionate about trying to serve the community and assisting members in a big way or small ways, it doesn't matter. But really importantly, this is a total just golden opportunity that has fallen into our lap. Typically in the springtime, there is no open enrollment period. So if you know anybody in your inner circle that is not covered, maybe could, benefit from coverage, please just have them give us a call. This expires again May 15th. So you are officially on a 73-day countdown. They can jump on to floridablue.com. They can schedule a phone or video appointment. Some prefer video when talking about really private, health information. And of course, they could give us a call at 877-352-2583. And if they ask you, why Florida Blue? What do you know about them? Just please, if there's one thing you're going to let them know, please just tell them that we do far more than sell health insurance, and we really just want to assist them on their journey. Thank you for your time guys today, and we'll talk to you soon.
Great. Thank you so much, Lauren. That's good information. I'm sorry, I have got a tickle in my throat. I'm going to try to get through this, but please do put your contact information in the chat box, and that would be great. That way we'll have, a way to get in touch with you. You guys are all in for a special treat today. Karen Hughes is joining us from the American Lung Association. Since moving to the area in 2005, Karen has been an active member of the JAX chamber and a lover of all things Jacksonville. And that is the truth. She does love Jacksonville. After spending the first decade of her career as a leader in retail banking, she decided to shake things up in her career and entered the nonprofit sector. I remember that, Karen. Beginning at the American Lung Association as a development manager for the local office. She now serves a dual role as local executive director and national director of special events. She thrives on helping others and believes that longstanding history and achievements of the American Lung Association give her the best platform to positively impact her community. Karen is a former recipient of the Jacksonville Chamber Beach's Walter R. Murr Award for service and has also served on the Beach's board. She's a proud graduate of the College of William and Mary in Virginia. Karen now lives in Atlantic Beach with her husband, Jason, and her newborn son, Bodie, who is adorable. So something that Karen and I recently learned about Karen and thought was hysterical, I love her husband, Jason, as well, is that Karen and Jason have decided to document first for Bodie, but they're doing it a little bit differently. If she wants to talk about it, I'll let her, but let's just say the first explosion that Bodie had, maybe the first spit up, and the list goes on. But what I will tell you is I was privy to be the first fund development meeting that he got to go to. And let me tell you, he nailed it. Another fun fact is Karen loves Bruce Springsteen. So take it away, Karen.
That was quite the introduction. Amanda and Kathy, are y'all pulling the presentation back up so I can go by those slides as well? That would be great. While you're pulling those up, I will share that Ashley and I have known each other for several years, and pre-COVID, I never would have thought of taking my 4-month-old to a business meeting with me. But because of COVID, it's just kind of what it was. And it was a meeting with Ashley. And so there is, I think all of us have been in the position of seeking those silver linings of the last year. And so the flexibility to have a business meeting while holding my newborn child, it's not something I take for granted. So Ashley, thanks for that flexibility and for that really kind introduction. Today, I do want to share, I guess I should say first, I am 3 weeks back to work from maternity leave, so still dusting off the cobwebs. So be patient with me if there are times where I'm maybe not as fluid in my speech as I would normally be. But I'm excited today to share with all of you the history of the American Lung Association. We've been championing lung health since 1904. Next slide. The agenda you'll see very brief, just a couple of topics. Jason, you gave me a great lead in. Today, instead of giving a chronological history of our organization, I'm going to give you some of the history just based on the women who've been part of our of shaping the organization. I'm going to share some of the ways that we're addressing health disparities in the communities that we serve. I'm going to update you all on our COVID-19 Action Initiative and then share some local opportunities to get engaged with the American Lung Association. So starting with the women who've helped shape the, you know what, see, I was ahead of my slides already. Again, we have 115 years. No, you're good for the next one. Yep. Again, many people think of our history as it relates to championing for tobacco-free spaces, but we also do have work in clean air, for clean power plans. When we first formed, it was really to address the tuberculosis crisis. But really one of the things we're most proud of is that we pioneered the model of education, advocacy, and research. And that 3-tiered approach is really used still today in addressing all public health issues. If you think about COVID-19 as an example, most organizations and most companies that are working to address COVID-19 are following the same model that we constructed and started decades ago, that we educate, that we advocate, and that it's research-based. Next slide. So diving into our women, I'm pleased to introduce you to Emily Bissell today. In 1907, she, a volunteer from Delaware, launched the first Christmas Deals fundraising campaign. And the idea is that they would be a penny apiece. The goal of this team was to raise $300, and in the year of 1907, they raised $3,000, so 10 times their goal. And her fundraising efforts really became the blueprint for grassroots activism and for the fact that a volunteer who is passionate about a cause can really be instrumental in helping that cause move forward. Even though she passed away in 1948, the Christmas Deal campaign still exists today. Part of her legacy also for the organization is that she talked about the importance of leaving a gift at your death. So she helped us establish the Legacy Society, which of course, anyone who's a member today are individuals that have indicated in their will or in their final planning that a final gift will be given to the American Lung Association. So we're so grateful that she really led the way in that concept in her service to the Lung Association. Another woman who had and there's some Christmas Deal campaign stickers for you. One is 2011, the other one, it's not clear enough because we're literally working off like pictures from film, from a camera in that image. Another woman who has been, who gave greatly to the American Lung Association is Dr. Edith Lincoln. And in 1950, she discovered that the antibiotic isoniazid prevents serious complications of tuberculosis in children. At that time, tuberculosis had gone from being the 3rd leading death to number 7. But certainly, if you think about the population of women that were doctors in 1950, it was very, very few. So for one of those elite doctors to really have a role in addressing tuberculosis, it's something that as an organization, we're really proud of. Following Dr. Edith Lincoln, Dr. Mary Ellen Avery. And in 1959, she was a researcher grantee, meaning funds that the Lung Association raises that we then allocate to researchers and to scientists to do work in lung health. So we funded Dr. Mary Ellen Avery. And she discovered that the lungs of newborns that were experiencing respiratory distress syndrome lacked a fatty substance that she then coined surfactant. So this finding led to improved treatment. You may or may not know that one of the last organs that develops in utero are the lungs. And so this respiratory distress syndrome is really common in infants that are born preterm. It's been estimated that through 2020, more than 800,000 newborn lives have been saved from what Dr. Mary Ellen Avery learned. So talking about having an impact that exists today, that's certainly something that we're proud of, that our research funding dollars funded her, and this was the learning that she gave us all. We've, of course, had celebrity involvement throughout our 115-year history. You'll see here a couple of pictures of Jackie Kennedy and Carol Burnett, who both joined on as celebrity ambassadors for our cause. That continues today. We have Queen Latifah, Laura Dern, Chantel Van Santen. So that continues to be a cause that we find there are people who have a really personal story to lung health that wish to come aboard and help us with our cause. Patty Young may be a lesser known name. Patty Young was a flight attendant for American Airlines. And for those of us, depending on what age you are, you may or may not remember that there was a time that in commercial airlines, people could smoke. There was a smoking section and a non-smoking section in airplanes, much like there was in restaurants at one time. And if you've also ever flown, you know that the thought process of having a smoking section and a non-smoking section on an airplane is pretty ridiculous. You know, if someone's smoking, it's a smoking section when you're all in a small tube flying through the air. So as part of her job, she really started advocating, saying that I deserve to have clean air when I'm at work. So that changed forever the precedent for employers to have to prioritize health in the workplace. And she was a great advocate for the American Lung Association. There's actually, it's rough quality because of its age, but there's a YouTube video of her advocating in front of Congress, talking about her right and the right of her coworkers to go to work and to have smoke-free air. And so she really, really helped with that. And ultimately, in 1990, all domestic flights had a smoking ban, and that has now extended so that it's a widespread ban to all flights. So Patty Young is a really instrumental woman for lung health for all of us. And lastly, I'll share with you another woman in celebration of International Women's Day, Janice Nolan. Janice has had a real heart for understanding air quality and how that affects lung health. She worked on the National Radon Action Plan Leadership Committee. And many of you may not know that in the state of Florida, radon is the second leading cause of lung cancer. And so radon is prevalent, and it's something that she really cared about. She also helped as the instrument for one of our 3 signature reports that we publish every year. We publish the state of tobacco control, the state of lung cancer, and the state of the air. And she really helped spearhead and lead that state of the air publication, which dives into the air quality in every state in our country, and then addresses how we work on it based on what those results are. So we lost her last year, but certainly her legacy lives on in our organization. Excuse me. So turning the tide from many of the women that have formed our organization, have been instrumental. I know that this group, as the Health Council, obviously has a tremendous interest in health of our community. And part of addressing health in the community, of course, is taking an honest look at health inequities and disparities in different communities across the country. And so the Lung Association has always really had their eye on health disparities in different populations. And I'm pleased today to share some of the work that we're doing specific to the Black community. So we did launch last year Lungcast. So it is a podcast. And I think it's, again, the podcast itself is one of the silver linings of COVID-19, when we all realized we needed to meet our constituents where they are. And podcasting is one of the ways to do it. So the newest episode of our monthly podcast series features Donald Alcindor, who's a PhD in MS at Meharry Medical College in Nashville, Tennessee. He's sat down with Albert Rizzo. They're both nationally recognized, and they really talked about ongoing health disparities in Black, Brown, and other communities of color throughout the pandemic. So again, this demonstrates our acknowledgement and our commitment to addressing those health inequities that exist across our nationwide footprint. Also, coming up tomorrow, when I'm done with my remarks, I will try to get the link quickly into the chat. And if not, you can feel free to reach out to me. But we are hosting a webinar tomorrow entitled No Patient Left Behind, Black Men and Lung Cancer. On the right of the screen, you're going to see some startling things, some startling statistics. Lung cancer is the #1 cancer killer of both men and women in the United States. Most people don't know that. And Black men suffer disproportionately from lung cancer. In all of our research into lung cancer, we have found that Black men are more likely to get lung cancer and to die from it than their white counterparts, despite lower smoking rates in Black men versus white men. And additionally, lung cancer is typically diagnosed not as an early of a stage, and they're less likely to get treatment. And so we know we have work to do to change that. So these two individuals that are pictured here are leading this webinar tomorrow. Again, that's a free service to any and to all, and I'll drop that link into the chat here. Just another way that we're working to reach that community. Next slide. You'll find we have a great partnership with Dr. Jamie Rutland. And one of the things that he has really started working on for us is fostering trust of the COVID-19 vaccine. Unfortunately, we know that in some of the underserved communities across the country, there's mistrust of vaccine and of vaccines and of the healthcare system in general. And so he's a great advocate and guide for our organization in addressing that. On the next slide, you'll see how some of his work has helped to culminate. And we have released the COVID-19 vaccine toolkit and guide, and there are two partnerships that we're really proud of. We've partnered with the Center for Black Health and Equity, as well as partnering with the National Alliance for Hispanic Health to release and develop these science-based guides. So again, we recognize that there's some distrust and mistrust of the healthcare system in those communities, and that our goal is to educate and to get that information out there. You'll see at the bottom of this slide, and anyone can visit the site, of course, is lung.org/vaccine toolkit. Really great resources there to understand the science behind the vaccine and helping people to make informed decisions about the vaccine based on research and based on science data. And that takes me into the COVID-19 Action Initiative. So again, the Lung Association from our start in 1904, really to address tuberculosis, has evolved greatly over our last more than a century in terms of tackling lung health in the big picture. There've also been times where we really have to take on the specific disease states or conditions that arise, such as our work in lung cancer, which has really increased over the last 10 years as we've seen those statistics that it is the deadliest cancer. So as COVID-19 took us all by surprise right around a year ago, we realized quickly that it's for most individuals who are impacted, it's a respiratory disease and a respiratory condition in where they feel the impact. So again, launching off of our 3 tiers of which we do everything, research, education, and advocacy, we also added to this plan a coalition, knowing that we would need coalition building between private and public sectors in order to address COVID-19. But it's a $25 million commitment of a 3-year initiative to end COVID-19 and to prevent future pandemics. So we've already committed $3 million to research distribution in the last year. So again, we launched this initiative in April of 2020. So in less than 1 year, we have funded 12 researchers. So there are 12 COVID-19 grants totaling $2.4 million that are already at work across the country, across our footprint. And that includes molecular analysis, looking at COVID-19 in vulnerable communities. It's as widespread in terms of the elements of research that we're doing as most of our work continues to be. We've also funded the Airways Clinical Research Centers Network to support COVID-19 research. The Airways Clinical Research Centers are about 20 centers across our country who specialize in respiratory research and clinical research. We're fortunate that we have one here in Jacksonville. It's actually based in our Nemours Children's Hospital, and they have traditionally worked in pediatric airways research. Recently, through a consortium with UF Health, we're now running adult studies there as well. But we increased our funding to all of those centers so that they could add COVID-19 research to the work that they're doing. And we also rolled out a citizen study. So we've partnered, there's an app where anyone can get on and just kind of daily, you report how you're feeling, you report if you're wearing a mask, if those around you are wearing a mask, so that we can continue gathering data from across the country in terms of how COVID-19 is playing out. From an education standpoint, again, one of the 3 tiers of how we reach people throughout our entire history. We've hosted 7 COVID-19 virtual town halls, 7 patient webinars, reaching over 10,000 unique individuals who participated. Again, we launched our Lungcast, where we've had special guest Dr. Anthony Fauci a few times to really help us understand COVID-19 and what it means to the average American. And we've also helped by sponsoring healthcare provider training. We know that our healthcare providers are taxed more than ever before. I know we've all seen stories of doctors who've worked for 200 straight days, or nurses and doctors who are living separately from their family to keep their family safe. And so certainly we applaud those healthcare workers and know that we need to do our best to ensure that they are safe and that they feel safe. So we have contributed to training almost 63,000 healthcare workers in helping to keep them safe and care for their well-being throughout this pandemic. The next slide also just gives a little bit more of the education piece. So it details some of our blogs. We've had 1.8 million web views in the last year specific to COVID-19. And we also hosted a live streaming event with Queen Latifah, which received more than 250,000 views. So a lot of work to educate the general public about COVID-19. Lastly, you'll see that advocacy, again, typically our 3rd tier of approach, continues to be something that we've talked about. This relates to advocacy, again, in those addressing inequities in those communities that need it, talking about health coverage for COVID-19 vaccines, diagnostic and treatment. And so we continue to be engaged with legislatures at the local, national, and state levels across our footprint across the entire US. And then coalition building. So again, that's that 4th tier that we really added to this action initiative. So we do have an advisory panel that has come together. We have hosted vaccine roundtables with medical elite and community leaders across the footprint. So we have somewhat unique in that when you think of our competitors, if you will, so other nonprofits, we're partnering in this, we're coming together. Other health conditions certainly have an interest in understanding this. And so we are working together as a medical and as a nonprofit community. Our longtime partner, CVS Health, has partnered with us at CVS pharmacy locations. And we're really proud that we distributed more than 30,000 masks to public through community partners and public housing authorities across the US. So again, thinking about the inequities that exist, those communities that maybe wouldn't have access to it, we're really proud that through our work, we've been able to complimentarily provide 30,000 plus masks. And again, our partnerships always matter through corporate and foundation partners across that sector. So I know I'm a fast talker, but we're almost wrapping up. I will be mindful of time. So all of that brings me to how do you get involved locally? Our local fundraising events provide all of the dollars that then do the work that I've just shared with you. So we need to fund research, we need to fund education, we need to fund advocacy and coalition building, and we do that from money that we raise on the local level. So we have 3 signature events that we have here each year. The next one coming up is March 27th. It's the Fight for Air Climb. While it's typically held inside the Bank of America Tower downtown, climbing stairs, being mindful of the current pandemic, we're hosting it outside this year. It allows us to still do it, and we'll be climbing the stairs at TIAA Bank Field. It's open to children and adults, so age 6 and up. So it will be a race through part of the lower bowl of the stadium. It's the 13th annual year of the Climb for JAX here in our community, but again, the first year being held at TIAA. One of our other signature events is Lip Sync for Lungs. That picture on the left is from our first year, and it is what it sounds like. We take 5 or 6 local celebrities. They serve as our ambassadors and fundraisers, and it culminates with a live lip sync battle. So if you've seen Jimmy Fallon host lip syncing, or if you've seen the show with LL Cool J and Chrissy Teigen, it is that, but real and in Jacksonville and in person. And it is probably the funnest thing I get to do as part of my work is attend that event. We also have our One Force Run Walk that takes place each August in our community. And so again, whether you're looking to get involved as an individual or as someone representing the company that you work for, these are 3 great ways that we would love to have your help in Jacksonville. And so here are some great thank yous. When I looked at the roster of who was attending today, I realized that in some cases I might be preaching to the choir because we have some great supporters that are on the line already. So a shout out to Ashley and Mirand. Mirand is sponsoring the Fight for Air Climb, and this is their 3rd consecutive year doing so. So thank you for being part of the answer of serving the lung health community. Florida Blue has supported the Lung Force Initiative for 5 consecutive years here in Jacksonville. Well Life Health Coaching, my friend Lindsay, who I know I said hello to earlier. She is a former Fight for Air Climb participant and committee member. She helped us secure sponsorships, both personally and bringing other companies into the fold. BDO, Jason, your colleague Elsa Martin serves on our local leadership board, so certainly grateful to have her support. And if she hasn't roped you into attending one of our events, I'll be sure to share your name now that I know it so she can rope you in next time. And then Nemours, we've had more than 10 years of our chief research scientist for the Airways Clinical Research Center based at Nemours. She has served on our local leadership board for more than 10 years, and they've been a sponsor of Lip Sync for Lungs for 3 of those years. And so my sincere ask for all of you today is who will join them? Again, we need your support. Lung health is, I think, on the radar, on the health radar of more people now than ever before because of COVID-19. And if you breathe air, if you have lungs, lung health matters. Lung disease can happen to anyone, and we invite all of you to join our cause. Again, we could not do the work we do without individuals and without these companies that are listed in our community. So I invite all of you, if you go to the next slide, you'll see my contact information. I would welcome a phone call or an email from any of you to say, hey, I want to get involved with the Lung Association. What's the best way to do that? We need your support. And so again, from that prior slide, so grateful for those of you that are already giving of your time, talent, and treasure to the Lung Association. And that wraps up my remarks. So happy to answer questions if we have time, or I will defer to Jason or others in terms of what comes next in the agenda. But thank you again all for listening and learning hopefully something about the great work that the Lung Association has been doing for over a century in our country. Thanks.
Great. Thank you so much, Karen. That was very informative and awesome. Super. All right, Jason, you're on.
Yeah, thank you again, Karen. And it was funny, you mentioned Elsa. She had actually emailed within BDO and had mentioned the I'm going to mess the name up, but the climb for Fight for Climb or whatever the name is. And so I'd reach out to Ashley, said, hey, this is something that's going on. Maybe this would be a good topic to talk about, for which led us to you. So it was everything kind of came together.
Very full circle.
Yeah, if you do have questions, put those in the chat. In the meantime, one thing that I was thinking of while you were speaking, obviously we've kind of bumped up against this as the Health Council and, trying to think about what topics are interesting to hear about. And, obviously I think everybody's got a little bit of COVID fatigue, but what is the Lung Association doing? Obviously COVID is something that's a very important topic, but at the same time, things like COPD and asthma and all the other, afflictions don't go away because of COVID. So, what maybe if you speak on what you guys are doing to kind of also, continue to preach awareness about those things while also, dealing with COVID, I guess.
Yes, so you're absolutely right. The other things don't go away. So for example, when we started looking at our lung cancer community last year, we knew we needed to really guide them to continue having conversations with their doctors, because it may be that risking going to the hospital for treatment might be, each case would be different in terms of, is that a greater risk for exposure versus should they delay treatment? So that's something that we really had to have really individual conversations in terms of, guiding our people to their direct oncologists, to their doctors. We have continued, Zoom fatigue is certainly real. But we have continued as many of our services as possible online in order to continue them. So we do have what's called Better Breathers Clubs, and those are support groups for adults living with lung disease. And we have about 16 across the greater Jacksonville area. Those are still meeting online, and then we're supplementing it with some of those town halls, some of the podcast listening. So we're still, doing what we can while dealing with that COVID fatigue, if you will. I will happily share with this group as well. Part of the work that we obviously have always done and will continue to do is regarding smoking cessation. And knowing that getting out to smoking cessation classes is a barrier, we are currently offering our online smoking cessation program at no cost. It typically has around $100 cost. And so that is something that is totally free now. So if you or anyone in your life is looking to quit smoking and that could be a resource, I would certainly encourage you to share it. We have really decided that at this point, for the greater good, let's make it free, let's make it accessible, so that we can continue to provide that service, even though it's in a different format.
Great. All right, we got one come in from Smitty. It says, what, if any, is your relationship to cystic fibrosis and any other respiratory affliction organizations?
Yeah, so cystic fibrosis, and again, it was in one of the former slides in my presentation, but really a lot of the research understanding the condition happens at the Lung Association. But the cystic fibrosis does exist as a separate nonprofit, and it has been that way for many, many years. So their specialty in doing so, cystic fibrosis is typically, most prevalent in children. And unfortunately, the life span is not always very long in those individuals. So whereas most of the work that we do is in adults, with some exception in dealing with asthma in youth, cystic fibrosis has really taken that one lung condition and focused all of their energy into that, which, we applaud. There's enough work to do that we both have enough work to do. There are 28 distinctly named and categorized lung diseases or conditions. And so the fact that one that is so harmful and it's, and again, impacts children, it has functioned separately for as long as I know. I don't know the exact year, Smitty, but we do function as different entities.
Great. Any other questions before we wrap up? Feel free to unmute yourself or add it in the chat. Going once, twice. All right. Well, thank you very much, Karen. We certainly appreciate you coming to share a little bit about what the American Lung Association is doing. And it's obviously a very timely topic with COVID and everything else going on. But, again, thank you. And
thanks for letting me be your guest.
We'll go to virtual networking. So I'm guessing we'll get broken out, Amanda or Kathy, into breakout sessions.
Yes, sir. And we'll probably do that for about 8 minutes, I think.
Yep, sounds good. So just take a couple minutes, introduce yourself. Again, be mindful of time. It's not, we're not going to have a lot of time, so make sure everybody gets a chance to introduce themselves. And then you'll automatically come back to the main room and we'll say goodbye and let you get to lunch.
I haven't done that in so long either.
We got 3 Karens in one room.
Mm-hmm.
That's funny.
That's funny.
Okay.
Pretty even.
All right. So what I'm going to do is I'm going to pause.
All right. Welcome back, everybody. We are right up against the 1 o'clock hour. So I just want to thank everyone again for joining us. I want to thank our speakers, both our spotlight speaker, Lauren with Florida Blue, and Karen with the American Lung Association for joining us. Very informative, and thanks again for everything that you're doing in the community. And I want to mention we do have our next meeting is on April 1st. So we meet typically the first Thursday of each month. So look for an invitation to that. And then also we're working on something a little special, trying to put together a virtual cooking class. So if that's something that you think you may be interested in, look out for some information on that in the future. So with that, I will say thank you and look forward to seeing all of you in April.
Thank you.
Thank you, Jason.
Thank
Good seeing everyone.
you.
Bye.